Thanks. Yeah, this is Paula Campbell with Illinois Primary Healthcare Association. One of the roles that I play here at the Illinois Primary Healthcare Association is marketplace assistance. We work with all of the FQHCs across the state, as well as other organizations, and making sure that those working in benefits with, whether it be marketplace or whether it be with Medicaid, have all the knowledge and information they need to have to help enroll people into marketplace and all the special circumstances that kind of come along with that. On the screen in front of you is a couple websites that I wanted to share. And actually, I guess if we wanted to share, I could pull those links up. But the first link is the getcoveredillinois.gov page. Hopefully many of you, yeah, go ahead and click on that. David, thank you.
I did. We'll see how it works for us.
Yeah, it should.
I'm learning in motion here.
Yeah. As far as everyone that's on the call, I think this is a really good link to have and to share and to keep on, like put it in your favorites category for your, you know, on your Chrome or Explorer. When working with the general population, if they're having questions around enrollment, if they qualified to enroll in marketplace coverage due to loss of job, there are several great forms that are on this page in multiple languages that can help a consumer walk through the process of enrolling and seeing if they qualify at this time to enroll in marketplace. Also on this website is a page to what's called the Get Covered Connector. And some of the organizations that are here with us today are probably enrollment specialists or CACs or navigators. We all go by a lot of different terms, but mainly it's an individual who is certified and able to walk a person through the process of enrolling in marketplace. And on the Get Covered Illinois website, there is a link that a person can put in their zip code, and they can find an assister, an enrollment specialist that they can talk to over the phone. They may be able to meet in person, depending with our COVID-19 response. But they could be meet maybe even via Zoom. Some of them are doing it. Everyone's kind of doing the social distancing and providing this service a little differently in each org. But it can get you connected with the phone number with someone who is trained expert that can talk through the process with you and with your client that you're serving to find out if they're able to enroll in the marketplace. So it's a very valuable web link with lots of resources and tools to help you help your clients get connected to marketplace coverage. The second link is to the Illinois Department of Insurance main page, and it has a list of all kinds of resources for individuals that they can use, both around insurance, around regular medical insurance, as well as around some of the other insurance policies that, because of job loss and unemployment and things like that that's happening, that could be a great tool. So again, I think this is a great link to have in your favorites category. So when you're working with a client, whether it's face-to-face, whether it's through a Zoom meeting, over the phone, we'll have resources that you can email. Excuse me. A little sip of water. That you can email or share. Both websites are things that you can help educate your community through as well by using your social media and your own websites. So if you know that you're working with different communities, you can help share this knowledge and these resources through your different outlets, whether doing it via social media, YouTube, things of that nature, sharing it with your school districts to put on their web pages, and other social service organizations like your own. You know, the more we share this information, the more accessible it's going to be to all of our clients to have at their fingertips to kind of read through and find out how they can, you know, reach assistance. The only other thing I kind of wanted to talk about was those of you who are in the enrollment setting, that this is part of what you do, is help those enroll in Marketplace. Right now, CMS is going through an update, and they're asking organizations who do this work to redo their agreement with CMS. So we want to be on the lookout for that. And if you have concerns about that process and how it is that you renew your agreement with CMS to be able to provide enrollment assistance, or if your organization would like to become an organization who can help enroll people in Marketplace, please feel free to email me or call me, and I'll help get you connected and help you walk through that process. It can be kind of cumbersome, and we want to make sure that you're able to do that. I think that's all I have right now around Marketplace updates. Is there any questions? You can see there's a few, but nothing around Marketplace.
One thing I wanted to emphasize, Paula, thank you for the presentation. The call right now is filled with organizations that are having face-to-face visits with clients and constituents who have lost jobs as a result of COVID-19. And although many of those would be folks who were not previously insured, many might be. And that face-to-face visit or screen-to-screen visit, when learning upon job loss, is a great time to ask the question, do you have health insurance? And if you had it in your old job, Get Covered Illinois should be your next step.
Yes, especially if they had it already, and then to understand what the SEPs are, which is called special enrollment periods. So if you've had job loss due to COVID, that requires that's a special enrollment period. If you've been married, divorced, all those type special enrollment periods can help a person now qualify to enroll in Marketplace. And on the Get Covered Illinois page there, on that link, when you visit it, there are several links with flyers in multiple languages that are clearly written to help a person walk through and identify what those SEPs or special enrollment periods are. So I think they're a great thing to share, have a few printed off. So if someone's coming in, if you're having people come into your offices, it's something you can easily hand to them to walk out with. If you're doing the screen share, they're technically advanced enough that they should have an email. You can simply email it to them. And I think it's just about having the knowledge and sharing it and making it as easily accessible as possible to all of our different clients that we're serving at this time.
Good. All right, I thank you very much. Were there any factual questions about Paula's presentation? Any questions for her?
Hi, David. This is Saima Asfar from ICNA Relief.
Hi, Saima.
So I want to know if those individuals, those who didn't had, insurance, can they still apply?
They can't apply for Marketplace unless they have the SEP, the special enrollment period. So there has to be a life-changing event that has occurred. So it have to have been loss of insurance, a marriage, a divorce, a death, something that caused them to lose their insurance, or if they didn't have it but got married, then that could qualify them to then receive insurance through Marketplace. But you also want to look at their, and Kristen's going to talk about this, Medicaid and what their income is. So if their income's at the right level, they can apply for that all year round. Marketplace just has that special enrollment period each year, and it takes unique circumstances to enroll when it's not during the open enrollment time period.
Thanks, Paula. Thanks, Saima.